সময় ছিল যখন যে কোনো অপারেশন মানেই ছিল বড় কাটাছেঁড়া লম্বা দাগ। এখন সার্জারি করার দুনিয়ায় ঢুকে পড়েছে রোবটও। আচ্ছা, সার্জারিটা কি রোবট করবে? ডাক্তারবাবু দেখবেন না? চেন্নাই অ্যাপোলো প্রেজেন্স ডাক্তারবাবু কি বলছেন? Everyone is like talking about robotic surgery.
When you perform the same operation by making just holes in the abdomen.
Is it really the robot is performing the surgery, or?
Short answer, it is only the surgeon doing the operation. The robot doesn't do the operation.
If the machine fails in mid-surgery?
The robot itself comes with a built-in safety mechanism.
Big complex abdominal surgery.
It has been proven in trials that robotic surgery is better.
These are also like scar-free or less scar.
These small scars, they fade away quite well. And if you ask them to point out in their own
They
tummy
can't.
where their scars are, they would be searching. They wouldn't know whether it was on the right side or the left side. They've forgotten.
একটা সময় ছিল যখন যে কোনো অপারেশন মানেই ছিল বড় কাটাছেঁড়া লম্বা দাগ এবং হাসপাতালে দিনের পর দিন রোগীর শুয়ে থাকা। এখন সেই ছবিটা বদলেছে। ছোট্ট ছিদ্র কম ব্যথায় হয়ে যাচ্ছে অনেক বড় সার্জারি। রোগী সুস্থও হচ্ছেন অনেক তাড়াতাড়ি। শুধু তাই নয়, এখন সার্জারি করার দুনিয়ায় ঢুকে পড়েছে রোবটও। কিন্তু বিজ্ঞান যত এগোয়, যত আধুনিক হয়, ততই সঙ্গে নিয়ে আসে নানা প্রশ্ন, সংশয়, বিভ্রান্তি, ভয়। এত আধুনিক সবকিছু নিরাপদ তো? আচ্ছা, সার্জারিটা কি রোবট করবে? ডাক্তারবাবু দেখবেন না? এই সমস্ত প্রশ্ন নিয়ে আজ চেন্নাই অ্যাপোলো প্রেজেন্স ডাক্তারবাবু কি বলছেন। ডাক্তারবাবু ঠিক কি বলছেন জানতে দ্য ওয়াল আরোগ্যর নতুন পডকাস্টে আমি তিয়াস। আমার সঙ্গে রয়েছেন চেন্নাই অ্যাপোলোর সিনিয়র কনসালটেন্ট সার্জিক্যাল গ্যাস্ট্রোএন্টারোলজিস্ট এবং ল্যাপারোস্কোপিক ও রোবোটিক সার্জন ডক্টর J.K.A. Jamil. Welcome, sir. Welcome to the Wall Arogya.
Thank you so much.
Sir, firstly, I would like to know, when I was looking at your bio and your details for my purpose, there is so much degrees and your expertise and like that. ये लगता है दुनिया की कोने कोने में घूम के आप सबसे अच्छा knowledge gather किया है. Sir, can you tell us briefly like what is about your field of expertise and your training part?
I'm Dr. J.K.A. Jamil.
Right.
I'm a surgical gastroenterologist, laparoscopic surgeon and robotic surgeon at Apollo Hospitals in Greaves Road in Chennai. I also occupy a chair of a professor in Apollo Hospital Education and Research Foundation and a chair of a professor in Tamil Nadu Dr. M.G.R. Medical University. I trained and worked in the UK for almost 14 years. I'm currently the International Surgical Ambassador for the Royal College of Surgeons of Edinburgh of UK in India. After having spent close to 14 years in the UK, I was also a consultant surgeon in the UK. After almost 14 years, I came back to India in the year 2013, and I've been in Apollo hospitals ever since. I deal with a wide variety of gastrointestinal diseases. I'm a surgeon basically, so I offer surgical treatment for a variety of gastrointestinal diseases, and I offer patients open surgery, laparoscopic surgery, robotic surgery, as per the indications.
Yeah, like fantastic, doctor. And you performed so many long years in this field. Sir, now come to discussion about surgery.
Yeah.
We all know about laparoscopic surgery. For like last 10 years, ये चर्चे में है कि laparoscopic surgery क्या होता है। एक और कुछ ज़्यादा छोटा सा holes होता है, उस पर surgery हो जाता है। Sir, what makes the next level robotic surgery? Like, everyone is like talking about robotic surgery. Is it more finer and more hassle-free? What's robotic surgery?
Right. So to understand this question, we need to step back a bit. So we need to understand what minimal access surgery or minimally invasive surgery means.
Yeah.
See, if there's a problem, I'll give abdomen as an example. Okay, minimal access surgery is a general term. You can use that for surgery in any part of the human body. But because I'm a GI specialist, I want to explain this from the perspective of abdominal problems. So if there is a cancer of the colon or a cancer of the stomach, the traditional way of doing it is by opening the abdomen and removing the cancer. So that's open surgery. Minimal access surgery is when you perform the same operation by making just holes in the abdomen instead of making a big cut. So the operation that you do inside is exactly the same.
Okay.
Exactly the same, but the approach is different. Instead of making a big cut, you just make few holes. And this minimal access surgery in the abdomen is what was known as laparoscopic surgery. I mean, laparoscopic surgery is not new anymore.
Right,
I mean,
yeah.
if you think about it, the first laparoscopic cholecystectomy was done in 1985. So it's almost 4 decades now since laparoscopic surgery came into the field of GI surgery. Over a period of time, a lot of advancements have happened in the field of laparoscopic surgery itself. And then a new aspect of minimal access surgery came in. You could perhaps call it as an evolution within the field of minimal access surgery, and that is robotic surgery. So how is it different from laparoscopic surgery? Essentially, this also involves holes in the abdomen. But instead of the surgeon introducing long, slender, straight instruments and performing the operation, the surgeon introduces robotic instruments. And these robotic instruments are so different from the laparoscopic instruments. I mean, the dexterity of these instruments is better, the angulations are better, and we say a robotic instrument mimics the human wrist, and we even call it as an endo wrist.
Okay.
A robotic instrument is called an endo wrist. It has 7 degrees of freedom. As a result, we are able to operate in a more precise fashion, and we are able to operate in areas which may be quite difficult to access with laparoscopic instruments. And lastly, the cameras which come with these robotic systems are all very sophisticated cameras, and we get a lot of
magnified
views. I mean, it is said that the vision that we get in the robotic console is about 10 to 14 times magnified, and you get a 3-dimensional effect as well. As a result of this, we are able to offer our operations in a more precise way and give better results.
Yeah, like more flawless. That's
right.
So when people think about robotic surgery, the word, they like always imagine a robot is doing the surgery, performing the OT table and all. Is it really the robot is performing the surgery, or it is still in doctor's control? What's the mechanism?
Very common question and very common perception. Okay, ever since robotic surgery came in, this question is being asked. And it's good that you asked me, because it's an opportunity for us to clarify
our viewers and all.
Exactly, to clarify to your viewers. Short answer: it is only the surgeon doing the operation. Okay, that's the short answer. The robot doesn't do the operation. That's the short answer. If I have to give you a long answer, I need to explain the system in a bit more detail. Would you like me to do that?
I will like to hear.
Right. Okay, so see, the robotic system can be divided into 3. There are 3 parts, right? There's one part which is called the patient cart. The second part is called the surgeon console. And the third part is called the vision cart. So the patient cart, that's where the actual robotic arms are, right? So as I told you before, we need to make holes, just like how we make the holes for laparoscopic surgery. And through those holes, the surgeon introduces the robotic arms. So it is a surgeon doing it. I mean, the robot doesn't walk in and come and stand next to the patient and introduce all the arms.
Common imagery.
And starts doing the operation. Absolutely not. The surgeon introduces the robotic arms into the patient, and once he's set everything up, the surgeon moves to the robotic console. And the robotic console is another equipment, part of the robotic system, which is usually about 10 feet away from the patient. And the main surgeon, the operating surgeon, goes to the robotic console, but the other surgeons, the assistant surgeons and the staff nurse and other assistants still remain next to the patient. So the operating surgeon who goes to the surgeon console does the operation from there. So he's got a monitor in which he looks at everything that's happening inside the abdomen. And he's got master controllers. He's got finger controls and foot pedals through which he does the operation. So basically the movements of the surgeon's fingers are translated to movements of the robotic instruments which have been placed inside the patient's abdominal cavity. Right? So every single movement that happens inside the patient is a result of what the surgeon does at the surgeon console. So there isn't any independent movement or independent thinking of the robotic arm whatsoever, right? And which is why I started off by saying it's a surgeon who's in charge. Surgeon is the one who's doing the operation. The entire process, the surgeon moving the fingers there and the pedals there, the robotic instruments moving inside the patient's abdominal cavity, the entire action can be viewed by the rest of the theatre team in the camera, which is in the vision card. So that's the third part of the robotic system. Remember, I told you there's the patient card, there's the surgeon console, and the vision card. And in the vision card, there's a monitor there. Anyone who's in the operating room can watch what the surgeon is doing over there. And the vision card also has other things which are essential for the operation, like the energy devices, we call them, and then the recording aspects and various other things, the insufflators and so on and so forth. So essentially, contrary to what many people may think, it is not a human form robo walking into theatre, standing next to the patient, and putting the holes and doing the operation. It is the surgeon who is trained to operate this robotic system. The surgeon uses the system as a tool to perform the operation in a meticulous way, in a precise way, and by looking at the structures in a more magnified way. And that gives better outcome. There's no doubt about that.
যদি কারোর মনে এই ছবিটা থেকে থাকে রোবোটিক সার্জারি মানে একটা রোবট হেঁটে হেঁটে এলো দেন সার্জারি টেবিলে শুরু করলো কাজ, এমনটা একেবারেই নয়, যেটা ডাক্তারবাবু বুঝিয়ে বললেন। সার্জন ডাক্তারবাবু তিনিই পুরো কন্ট্রোলটা করেন, বাট দ্য মেশিনারি সিস্টেম, দ্য টোটাল যে মেশিন, সেই পুরো ব্যাপারটাকে বলা হচ্ছে রোবোটিক সার্জারি। সো স্যার, ইটস অল অ্যাবাউট ইকুইপমেন্ট, ইনস্ট্রুমেন্ট, মেশিন, মেশিনারিজ, মেকানিজম লাইক দ্যাট, অ্যান্ড ডক্টর ইজ পারফর্মিং অ্যান্ড অপারেটিং দ্য হোল সিস্টেম, রাইট? সো হিয়ার another question comes, people often afraid to ask. It's about machine. So if the machine fails in mid surgery, machine का तो कुछ गड़बड़ हो ही सकता है ना? ऐसा होता है क्या? Let's clear the fear.
It doesn't really happen. Let me be honest with you, okay? You're talking about the robo getting switched off.
Like that, battery drained, switched off.
It doesn't happen. It's never happened to me, and I don't really see that happening. The reason being, all of these are well tested and tried. It's not that somebody has manufactured a robot today and then brought it to the hospital tomorrow for it to be used by a surgeon for an operation on somebody. These robotic systems have gone through extensive check processes. A lot of research goes into manufacturing of these equipments. We're talking about years and years of research. And there are multiple levels of checklists.
Trials and all.
Absolutely, that these equipments go through before they get licensed to be operated on real patients. And so such events, I've not heard of such events. And the robo itself comes with a built-in safety mechanism. In other words, if there was something that was going to happen that is not desirable, the robo has an inherent safety mechanism to avert it. So really, such instances do not happen. But then, okay, hypothetically, I mean, your question is more of a hypothetical question, if I may say. If ever that happens, again, I go back to the answer that I gave you earlier. Who was doing the operation in the first place?
The surgeon.
It was the surgeon who was doing the operation, not the robo. So if ever that happens, the surgeon...
He is in still full control.
He is in full control and he completes the operation.
Okay. So, যন্ত্রের যন্ত্রণা শব্দটা আমরা বলে থাকি, কিন্তু এক্ষেত্রে যখন মানুষের প্রাণ নিয়ে, মানুষের জীবন নিয়ে কাজ করছেন ডাক্তারবাবুরা, সেখানে কিন্তু যন্ত্রণার কোনো অবকাশ নেই, সেখানে কোনো রকম ফাঁক ফোকর নেই, নিরাপত্তার সঙ্গে কোনো আপোষ নেই। So, doctor, coming back to another question, when big complex abdominal surgery, let's think like liver का भी कुछ हिस्सा जुड़ा हुआ है, कोलन का भी कुछ गड़बड़ है, मान लीजिए पैंक्रियास भी कुछ ये ऑपरेशन का अंदर है, तो इतना बड़ा जब कॉम्प्लेक्स ऑपरेशन होता है, इसमें ये रोबोटिक सर्जरी डज इट गिव यू लाइक मोर शार्प विजन एंड फाइन कंट्रोल?
Absolutely, absolutely. See, this is a subject that we discuss all the time in surgical
Yes.
conferences. There are some surgeries for which robotic surgery doesn't really have much of an advantage to laparoscopic surgery in terms of overall outcome.
Yeah.
But there are a number of surgeries where it has been proven in trials that robotic surgery is better in terms of diminished blood loss, early recovery, early discharge, faster return to work, and particularly in cancers, increased amount of lymph node retrieval. Lymph nodes are small structures that are around the major organs, and when there is a cancer in one organ, it tends to go to the lymph node.
And we need to remove the node sometimes.
That's right. So a radical cancer surgery involves not just removal of the organ, but also removal of the adjacent lymph nodes. And there are numerous studies which have come up in the last few years which have shown that there is an increased amount of lymph node retrieval rate with robotic surgery than with laparoscopic surgery.
Okay.
And there are some studies which have also said that the margin clearance, margin refers to the cut surfaces. You say if there is a cancer here, you got to cut it all around, right?
Okay.
So that is called margin.
Yeah.
I mean, the margin has to be free of cancer, obviously. Right. So if the margin is positive for cancer, it's not really a complete resection. So there are some studies, particularly in esophageal cancers and in pancreas cancers, and liver cancers as well, where robotic surgery has been shown to give an increased margin clearance.
Okay.
So with robotic surgery, there is less chances of margin positivity.
Okay.
That's how we call it in medical terms, margin positivity, which is great for the patient. And that translates to decreased chance of cancer recurrence, increased disease-free survival, and increased overall survival. So there are definite benefits.
Okay.
And I mean, as I mentioned right at the beginning, the blood loss is minimal.
Okay.
We see better. 10 to 14 times magnification. We get to see things better. We know exactly where the little blood vessels are.
Where we need to reach like that.
So, not that those little bleeds from those blood vessels will cause any major impact to the patient's health, but then by stopping even that kind of little bleed, by seeing better and coagulating them before they're actually cut, the trauma to the patient is much less. The dissection is much nicer. So we are able to get to planes in a much nicer fashion. Clean dissection, to put it in simple words. As a result, the blood loss is less. And the blood loss is less. For some reasons, the pain is also less.
Post-operative recovery is also faster.
And the need for blood transfusion goes down dramatically.
Okay.
There are so many major resections, including cancer resections, that we have done with no blood transfusion.
Right. শুনতে অবাক লাগছে, ক্যান্সারের মতো খুব মেজর সার্জারিও রোবোটিক সার্জারির মাধ্যমে মিনিমাম রক্তপাতে ঘটছে, কোনো ব্লাড ট্রান্সফিউশনও লাগছে না। স্যার, দিস টাইপ অফ মেজর অ্যাবডোমিনাল সার্জারিজ, দিজ আর অলসো লাইক স্কার ফ্রি অর লেস স্কার ফর নাওয়াডেজ?
You mean scar free?
Yeah.
Scarless or scar free? I wouldn't say scar free. Okay. I know there's this talk about scar free, scarless surgery,
and big scar points and all like that.
Let me explain that in a bit more detail, if I may. There isn't anything like scarless or scar-free surgery. I mean, if you are making a hole in the abdomen,
that's also a scar.
If it's going to heal, it's going to heal with a bit of a scar, right? We're talking about big scars versus small scars, right? If you are doing an open surgery, it's a big incision and it's a big scar. If you're doing laparoscopic surgery or robotic surgery, there are holes, and we're talking about 8 millimeter holes, 10 millimeter holes, 12 millimeter holes, 5 millimeter, and these holes cause smaller scars because these are smaller. I can understand why people say scar-free or scar-less, and that's probably why you're also asking me this question. See, these holes, these robotic incision holes or laparoscopic incision holes, they heal very well. They heal very well, and 3 months down the line or 6 months down the line, many a times, patients can hardly detect the place where
that's why I'm asking, and viewers also ask.
Yeah, so
because like in comparison with open surgery, it's long scar and stitches and like that.
Yes.
Comparison to this, they're minimal, almost like scar free.
So, when 6 months down the line, sometimes when you see a patient and when you examine, you most of the scars have faded away. Again, it also depends on the healing properties of people's skins. I mean, different people have different healing properties. But by and large, these small scars, they fade away quite well in 6 months to a year. Sometimes patients come back, 3 years down the line, 5 years down the line, and if you ask them to point out in their own tummy where their scars are, they would be searching. They wouldn't know whether it was on the right side or the left side. They've forgotten. It's not there. It's not there for them to look, and they've forgotten.
सर, ये सुन के लग रहा है, मेरा दिमाग में चल रहा है कि कुछ साल बाद, like some decades to like that, is the open surgery ये history बन जाएगा, like to be more explanatory कि once upon a time open surgery होता था, ऐसा लोग बोलेगा, या open surgery will always be there for some specific type of operations, or the surgery will be synonymous to robotics? What is the future you think of?
See, the open surgery will still remain. I'm not suggesting in any way that all surgeries will be replaced by laparoscopy or robotics. It's a big topic to discuss, to be honest. But to put it in simpler terms, the job needs to be done properly inside, right? Whether you do it laparoscopic or robotic, it shouldn't really matter. The end result is what matters, and it also, I mean, the surgery that gets done by a particular surgeon for a particular patient also depends on the environment in which he operates, the infrastructure that's available to him. So not every place is the same, right? So you got to give the best of healthcare to your patient in the environment in which you operate. And if it means that you only have this particular facility, say if you can only do it laparoscopic, that's fine. That's absolutely fine. You don't. It doesn't mean that you have to be doing everything robotic.
Everything with robotics.
We're far away from that situation. And no matter how proficient we get with laparoscopy or robotics, there will always be occasions when we have to be doing open surgery. There will be occasions. I mean, there's bound to be situations where laparoscopic surgery would be difficult or impossible. Even and the same applies to robotics as well. And we have to convert and open up the abdomen and do it the traditional way. And so a good surgeon should be able to do all types of surgery, open, laparoscopic and robotic. And
experienced surgeon will take the final call that which patient needs which type of surgery and all like that.
Yeah, that's right. I mean, that is a decision that is not just based on the surgeon's analysis of the problems, but also, as I said, the facilities available.
The infrastructures and all.
Exactly.
Yeah, right. That's fantastic, sir. I would just like to know something lastly, that what will be your take-home messages for our viewers? Some like two, three sentences or messages, please, sir.
Take-home messages. Well, I would say if you have a symptom that is been bothering you for a very long period of time and you're not quite sure as to why this is happening to you, it's better for you to consult your doctor and get it properly evaluated. Don't leave it till it becomes too big, because we are living in an era where if things are identified early, good treatment is available.
Okay.
Medicine has advanced, big time. Medicine and surgery has advanced big time. Technology even in the last 3 to 4 decades. And if we can report our symptoms at an early stage to our doctors, there's excellent investigatory modalities available and excellent treatment modalities available.
Okay.
We just need to keep our eyes open for that.
খুব গুরুত্বপূর্ণ কথা বললেন ডাক্তারবাবু। কোনো অসুবিধা বুঝলে দ্রুত ডাক্তারের কাছে পৌঁছান, কারণ চিকিৎসা বিজ্ঞান এখন এতই আধুনিক হয়েছে, আগেই রোগ ধরা পড়লে আমরা কিন্তু অনেক বিপদ এড়াতে পারি। অপারেশন মানেই কিন্তু এখন আর শুধুই কাটা ছেঁড়া সেলাই করা নয়, এটা একটা নিখুঁত পরিকল্পনা এবং সেই সঙ্গে দক্ষতা ও প্রযুক্তির সঠিক মিশেল। কোন রোগীর কখন কোন অপারেশন সবচেয়ে ভালোভাবে কাজ করবে সেই সিদ্ধান্ত কিন্তু একমাত্র নিতে হবে সঠিক তথ্য এবং সঠিক গাইডেন্সের উপর ভিত্তি করে, ঠিক যেমনটা ডক্টর জামিল আমাদের বোঝালেন সেই সুদূর চেন্নাই অ্যাপোলো থেকে এসে। এই এপিসোড আপনাদের ভালো লেগে থাকলে লাইক করুন, কমেন্টে মতামত জানান এবং অবশ্যই শেয়ার করুন। ততক্ষণ দেখতে থাকুন দ্য ওয়াল, কারণ খবর এখন এখানেই।